Hello, this is your Good Neighbors Network headlines for July 25th through July 31st, 2026, brought to you by World Grace Project. This week, immigration enforcement expanded at some U.S. airports, Haiti's temporary protected status officially ended, and a new federal rule changed how some affirmative asylum cases may be processed. A federal judge also blocked a nationwide policy allowing ICE to make civil arrests at immigration courthouses. Nationally, Medicare reached its 60th anniversary as new changes to prescription drug subsidies were announced, and fighting between the United States and Iran continued while Congress debated the president's authority to conduct military operations. Let's begin with immigration. Reports from the Washington Post and CNN, along with information from the Department of Homeland Security, indicate that U.S. Immigration and Customs Enforcement, or ICE, has recently expanded immigration enforcement at some airports across the country. According to the reports, ICE officers have detained some travelers at airport check-in areas, security checkpoints, and arrival terminals. Reported cases have included people with expired visas, pending immigration applications, and other unresolved immigration matters. The Department of Homeland Security has said it is using traveler information to identify some individuals for immigration enforcement. For people with pending immigration cases or unresolved immigration status, these reports suggest that domestic air travel may now carry additional immigration enforcement risks. The Department of Homeland Security has encouraged people to use official resources to understand their current immigration status before traveling. USCIS announced that Haiti's designation for Temporary Protected Status, or TPS, officially ended on July 27th. According to USCIS, employment authorization documents issued through Haiti's TPS designation are no longer valid based on that status. Temporary protected status allows people from certain countries experiencing armed conflict, natural disasters, or other extraordinary conditions to live and work in the United States for a limited time. Haiti was first designated for TPS after the devastating 2010 earthquake and had been extended several times over the past 16 years. The end of Haiti's TPS designation affects hundreds of thousands of Haitian nationals across the United States, including families here in Iowa. Additional information is available from USCIS. This week also brought an important change to the affirmative asylum process. The Federal Register published an interim final rule on July 28th stating that U.S. Citizenship and Immigration Services, or USCIS, may now refer certain affirmative asylum applications directly to an immigration judge without first conducting an interview with a USCIS asylum officer. According to USCIS, the change is intended to help reduce an asylum backlog that has grown to more than 1.4 million pending cases. The rule applies to certain affirmative asylum applications filed with USCIS and does not affect every asylum case. The rule is now in effect. Additional information is available from USCIS, and the complete rule has been published in the Federal Register. A federal judge in San Francisco also ruled this week that Immigration and Customs Enforcement, or ICE, cannot enforce a nationwide policy allowing civil immigration arrests at immigration courthouses. The judge also blocked a related policy that allowed some people to be detained for up to 12 hours after their court hearing. The court found that the policy violated federal administrative law. The ruling is currently in effect, although the federal government may appeal the decision. The court's written decision provides additional information about the ruling. This week marked the 60th anniversary of Medicare and Medicaid. The two programs became law in 1965 and began providing health insurance coverage on July 30th, 1966. Medicare helps provide health insurance for older adults and certain people with disabilities, while Medicaid is a joint federal and state program that helps provide health coverage for eligible people with limited income. Associated Press reported this week that the Trump administration plans to end a temporary federal subsidy that helped keep Medicare Part D prescription drug premiums lower. The administration says the subsidy is no longer needed because other policies to reduce prescription drug costs will remain in place. Premium information for next year is expected to be released later this year. Fighting between the United States and Iran also continued this week. Earlier this year, President Trump ordered U.S. military strikes against Iranian targets without first receiving a declaration of war from Congress. Those actions have continued to raise questions in Congress about the president's authority to use military force without prior congressional approval. The U.S. Constitution gives Congress the authority to declare war. In 1973, Congress passed the War Powers Resolution to define when a president may use military force without prior congressional authorization, and when Congress must notify Congress of military action. The recent conflict with Iran has renewed debate over how those constitutional and legal powers should be applied. Thank you for listening to Good Neighbors Network Headlines, brought to you by World Grace Project.